All right, the 20-week ultrasound. So this ultrasound can be equal parts really exciting and really nerve-wracking. It is typically the most comprehensive ultrasound that a woman will receive during her pregnancy. It typically takes about 45 minutes, sometimes longer if a mom is high risk. And it is primarily used to evaluate the baby's anatomy. So it looks for all sorts of things. So I'm going to tell you what that is. So the specialist, when they're doing the scan, they're going to look at the fluid levels in baby's brain. They're going to assess whether the baby has a cleft lip. They're going to assess the spine and hopefully rule out spina bifida. They're going to ensure that the abdominal wall is covering all of the organs, that none of the organs are growing outside of that abdominal wall. They're also going to confirm that both chambers in the heart are the same size. They're going to make sure that there's a good blood flow through the heart and confirm that the valves open and close. The valves in the heart open and close with each heartbeat. They also look at baby's stomach and make sure that they are swallowing amniotic fluid. They make sure that they have 2 kidneys, and they assess and measure the arms, the legs, the hands, and the feet. So that's baby. It's a really, really in-depth look at baby. A lot of ultrasound machines now are 3D. So during this ultrasound, you might see some like 2D, 3D images. The 3D images are pretty fascinating. It allows you to actually like see the shape of the baby's face. Like during my 20-week ultrasound, I could see that like my daughter has like a nose like mine and my husband's lips. So that's a kind of exciting, special part of this ultrasound. Obviously, the most exciting part of an ultrasound like this is if you get good news and learn that everything is good. So obviously that is what we're hoping for. And please know that if a concern comes up during this ultrasound, it doesn't necessarily mean the worst immediately. You know, I have heard plenty of stories where during this ultrasound, they suspect that something might be off, and then the baby's born and they're perfectly healthy. So don't immediately assume the worst if the doctor suspects that they might see some kind of defect. But I know that it is so nerve-wracking and so scary if that happens. So of course, feel the emotions that come up, but know that sometimes mistakes are made. Okay, so that's baby, but during this ultrasound, they will also assess the placement and the health of the placenta, the umbilical vessels, that umbilical cord, where it is, and the level of amniotic fluid, which is really important. They'll also measure the length of the cervix, because a really short cervix could indicate a risk for preterm labor. And if you didn't find out the sex through the NIPT blood test that I cover in another video, or that 12-week, or yeah, it's mainly the blood test where they look for the sex, then this is definitely the ultrasound where they should be able to tell you the sex. Sometimes if you get a 12-week ultrasound, they might be able to see the sex, but that early blood test or the 20-week ultrasound are much more accurate at determining the baby's sex. During this ultrasound, you can usually bring somebody with you. You know, when COVID was at its worst, usually you couldn't, but I know the place that I go for ultrasounds, they just started letting women bring their birth companions, so that's exciting, especially, again, because this ultrasound can be a little bit nerve-wracking. It can be nice to have somebody with us, especially to offer support if something does come up that can bring up, big emotions. It's also important to note that, if the ultrasound tech and not the doctor, which is common for, the ultrasound tech to do the initial ultrasound, if they don't say much during, that's okay. It doesn't mean that anything's wrong. Some will be like, yeah, no, everything looks good. Some just like stay pretty silent, give the results to the doctor and let the doctor either tell you, yeah, everything looks great, or we saw a couple little issues. And then sometimes, like if they do see issues, the doctor will do a little bit more of a scan. Honestly, even when everything's good, like my doctor or my the doctor that does the ultrasounds, first he has his ultrasound tech go in and do a really comprehensive ultrasound, and then he usually comes in, or in the 20-week ultrasound he did come in, he's like, yeah, everything looks great, but I'm still just gonna kind of take a look. And so he did more. But yeah, ultrasound techs, like especially if they see something that's kind of abnormal, they're not really allowed to say anything, because it's the kind of situation they might not be perceiving what they're seeing correctly, and so they want to give it to the doctor and let the doctor assess, you know, what was coming up on the ultrasound. So I know it can be frustrating when the person stays silent, but know that they might have been told specifically, like, you cannot say anything, so don't get upset with them. All right, if you have this ultrasound coming up, good luck. Take deep breaths. I know I was so anxious leading up to this one, so just like I would just picture my baby in light. Just try to stay as calm as possible. I try to distract myself in the days leading up to it so I wouldn't obsess. And yeah, just like I meditated in the waiting room, just did all I could to stay calm. It didn't take away all my anxiety, but it helped a bit. All right, if you have any questions about this or anything else regarding pregnancy, childbirth, early motherhood, let me know in the comments below.